offer. Sorry, something just popped up on my screen. Thank you for being part of our community forum series. Just a quick introduction. My name is Keneal Martin. I'm the founder and president of Hartford Lions Soccer Academy. We're a community-based youth soccer organization that obviously offers more than just soccer to our families. We want to get our families engaged with the community. We want to get the kids involved in the community. And it's so far it's been a great journey. I want to do a special shout out for Sinead for helping us to put together this presentation and putting us in contact with Dr. Barnes. As always, I want to also mention my board. Sean Buchanan is our VP. Leanne Thompson is on right now. She's our secretary, and Kamar Blake is our director of coaching. So big shout outs to those people. They do a lot of work behind the scenes. So anytime I get an opportunity to mention them, I make sure that I give them that public acknowledgement. So I want to now turn it over to Miss Leanne Blake and have her do her thing.
Thank you. So I want to introduce Dr. Jalisa Barnes. She received her bachelor's from Claflin University and her doctorate of psychology from Alfred University. Dr. Barnes is trained and experienced in applied behavioral analysis, cognitive behavioral therapy, norm reference testing, parent training, and school-based counseling. She has worked with children and adults with cognitive and developmental delays, such as intellectual disabilities, autism, and learning disabilities. She has worked with children and adults who have been diagnosed with ADHD and varying anxiety disorders, including selective mutism. Dr. Barnes is interested in continuing to help children succeed in school and at home. So without further ado, Dr. Barnes.
Hello, good afternoon, everybody. Thank you so much for the invitation, the introduction. I'm just so excited and happy to be here. I'm gonna go ahead and get started. I don't want to waste anybody's time. So I'm gonna be sharing my screen. It's gonna be a two-part presentation. I know we're mostly focused on mental health in children, but I also want to just highlight some of the important things or good things to know about mental health in adults as well. So bear with me 1 second. I'm gonna find my presentation. Okay, I'm going to start my slideshow. All right, so let's talk mental health. General mental health facts, anxiety, depression, bipolar disorder, they are the three most commonly diagnosed mental illnesses in the United States. Just a quick little rundown of statistics. 31% of adults in the US have a diagnosed anxiety disorder. 7% of adults in the US have at least one depressive episode, and 3% of adults in the United States have a diagnosed bipolar disorder. And when we talk about mental illnesses, the difference between a mental illness and maybe you're just having a rough day is that a mental illness impairs your functioning over time, consistently over time. So everybody has a bad day. Everybody experiences, highs and lows, ups and downs in terms of their emotional and mental functioning. But it becomes a problem when you have a hard time just going through life on a regular, consistent basis. Okay, so a little bit of definition. When we talk about anxiety, they can be described as feelings of fear, worry, and nervousness in response to unfamiliar and dangerous situations. Depression is when you have a sad or depressed mood, loss of interest or pleasure in activities that you normally would have enjoyed, and a general loss of energy. And then bipolar disorder is characterized by unusual shifts in your mood, your energy levels, concentration, and again, the ability to carry out day-to-day tasks. So again, everybody experiences all of these emotions and feelings throughout life. You know, if you're grieving, if you've lost someone that you love, you're going to experience a depressed mood, right? You're going to be sad. You're not going to be interested in a lot of the things that you might normally be interested. You know, if you're starting a new job or you're going to a new school, you're going to feel some anxiety because you don't necessarily know what you're walking into. Even bipolar disorder, you might have mood swings here and there. Everybody experiences that. Again, it becomes a problem when it interferes with your day-to-day functioning. So if you have those emotions, but you manage to kind of get yourself together, you can get up, you can do what you need to do, and they go away, you're kind of, don't necessarily need to worry about that. But when it's an ongoing situation, that's where you really need to pay attention to how to get some support. So these are just some common symptoms. And again, this is a very broad overview. Mental illness and mental health are there's so many things involved in mental health and mental illness. So these are very broad definitions and reviews. So I just want to keep that in mind. I mean, you could do a whole presentation on each one of these things by themselves. But anxiety, people who struggle with anxiety often have trouble sleeping, focusing, and just generally enjoying themselves because they're always worried. Again, excessive worry and concern about the future and things that you can't control, difficulty making decisions or questioning decisions that you've already made. People with depression often experience insomnia or they oversleep. They have what's called debilitating fatigue, which again prevents them from doing things like going to work, you know, taking care of themselves, you know, going grocery shopping, the typical day-to-day things. Increased or decreased appetite, difficulty concentrating or making decisions, unexplained aches and pains. And then bipolar disorder is a prolonged sadness or a heightened mood, and it shifts on a regular basis. You know, you can go from having reckless behavior to irritability and aggression, significant changes in sleeping and eating habits on a regular basis. So people with bipolar disorder, they kind of swing from a pendulum and it's two extremes. So, you know, you're going 3 and 4 days without sleeping and you're not tired, but then you go to sleeping for 3 and 4 days and you don't want to get out of bed. And again, these are very broad characteristics. And then I just want to touch a little bit on the impact of COVID-19 on mental health. So this pandemic has completely upended our lives, right? We have just, it's unrecognizable for a lot of people, how we spend our time, the ability to be close with other people, the ability to make plans. Most of us don't make long-term plans right now because we don't know, you know, what the world is going to look like from week to week. And generally how we think about daily routines and activities. We have seen an increase in suicides and overdose deaths. There have been spikes in anxiety and depression, diagnoses and treatment, significant losses. So people have lost members of their family, people that they know on a very large scale, which can lead to prolonged periods of grief. And then just collective and individual trauma, which simply means that a lot of the events that we have experienced within the last year or so have been very, very disturbing to us. And most of us probably needed some extra support in coping and just getting through. So let's talk about what causes mental illness. So there is no one thing that can be pinpointed to a mental illness. There's a difference between a mental illness and a trauma. So trauma is when something has happened and it affected you significantly in that moment and it has prolonged effects. So that can be traced back to something happened, it affected you, and this is the long-term impact that it had. Mental illness is a different situation because there's no one cause of a mental illness. It's usually a combination of genetics, your environment, and your temperament. And if you don't know what temperament means, it's literally just how you cope with things, how you deal with life in general. Some people are really kind of laid back and calm and they can kind of ride things out. Other people are very anxious and nervous just by nature. So depending on how you personally deal with things will have an impact on how mental illnesses will manifest themselves in you if you have one. Mental illnesses are often common in families. So if you have a family history of a mental illness, it doesn't mean necessarily that you will have it, but likely someone else in your family, as the generations continue, someone else in your family will exhibit those symptoms. While environment and upbringing don't cause mental illness, they can exacerbate the symptoms. So if somebody is very anxious, but they grow up with very supportive parents who can help them learn how to cope or kind of help them work through certain situations, it doesn't mean that they won't have anxiety anymore, but it might help to lower or limit the symptoms so that they can mostly function independently without a whole lot of extra help. Whereas if there's a lot of tension and pressure and, back and forth or instability, then it may cause your symptoms to be more heightened because there's really no way for you to learn how to cope, how to handle things. Again, a person's temperament and natural ability to cope, again, have an impact on the symptoms and the effects of mental illness. Having a strong support system often makes an impact on recovery and maintenance. So when you're surrounded by people who are accepting and who are able to, support you, they learn the strategies with you so they can remind you of what to do, that's a good position to be in because that will help you learn how to manage your own symptoms. All right. So when should you seek help? You should seek help if you're having a hard time functioning in any of the following areas: work or school. When it comes to self-care and personal health, again, that's taking care of your just day-to-day functioning, taking care of your hygiene, going to the grocery store when you need to, not letting things pile up, paying the bills on time, all of those things. And then your relationships. If you're look at how people are responding to you, just overall in life, are you hearing a lot of the same things from different people? Then maybe you want to get that checked out. If you're constantly worried or sad or generally just don't feel good about your life or about yourself most days, again, everybody has days where things happen, life happens, we have ups and downs. So everybody has time when they're stressed out or they're anxious, or I don't feel I look particularly good today. We all have those, but if it's a continuous and consistent thing, you want to get some help with that. If you are having dangerous thoughts or impulses like harming yourself or others, if you have a lot of thoughts about death or a lot of thoughts about getting hurt or hurting someone else, if you have deep-seated anger and you constantly ready to fight, those are things that maybe you want to have a conversation with someone about. And simply, if you think you may need help, then seek some help. You are the expert on yourself. So if you think that you might need to talk to someone, then you should talk to someone. Okay. And then these are just some general suggestions on how to take care of your own mental health as an adult. Deep breathing and relaxation exercises, they help to calm your body. Physical exercise or working out 30 minutes a day. The Hartford Lions can help you out with that. Positive thinking and reframing negative thoughts. So when you have thoughts that are overly worrisome, especially thoughts about things that you can't really control, you can kind of take charge of those thoughts and reframe them. So if you have a big project coming up and you're thinking to yourself, oh, I don't think I'm going to get that done in time, you can reframe that and you can say, actually, I can get this done and this is how I'm going to do it. So, change your thinking around so that you're not continuously impacting your own mood and your own perspective. Try to limit stress as much as possible. So if you're around people who maybe pluck your nerves here and there, set some time that maybe you're not around them all the time. I don't necessarily subscribe to just cutting people off. That's a personal choice, but I think that that's a last resort. But you can set up boundaries. You can tell people no. You can tell people, what, I just need some time to myself today. I'll call you later. Just doing those things to take care of your mental health. So let's talk about children and mental health. So in children, the 4 most commonly diagnosed mental disorders are ADHD, which is attention deficit hyperactive disorder, behavior problems, anxiety, and depression. So there's a little bit of overlap with children and adults in terms of the anxiety and depression. But in addition, we see a lot of difficulties with attention and behavior. And then these are just some numbers. 6 million children about have been diagnosed with ADHD. 4 million children are diagnosed with an anxiety disorder. 2 million children are diagnosed with a depressive disorder, and 1 in 6 children have just a diagnosed mental disorder. So we do see that mental illness is present in children in the United States, and it's a pretty big deal. Just a quick little overview of again, just the 3 disorders that I want to highlight. ADHD, I think, is important to kind of break down, because I think people have a limited understanding of what that is. I think when most people hear ADHD, they tend to think about the hyperactive impulsive type, which is where kids are, just kind of all over the place. They run around a lot, they're really busy and fidgety. But really, many kids are ADHD and have ADHD, and they're inattentive. Inattention looks like not really paying attention to detail, being really forgetful, avoidant of new and difficult tasks, and just overall not really listening. And when I say not listening, I don't mean not obeying, like literally just kind of tuning out. And inattention is one of those things that it's a little bit harder to spot and to prove, because many kids with inattention can kind of fake the funk. So they can look around and see what everybody else is doing, and they can kind of follow the motions. So it takes a little bit more attention to them to see that there might be something more happening underneath. Of course, hyperactive impulsive is the one that most people are familiar with. Again, you're fidgety, squirmy, trouble staying seated. Kids, they interrupt a lot more so than what's expected for their age or, grade level, talking too much, running and playing at inappropriate times. They just have a very hard time controlling their impulses. And then there's a combined type. So there are kids who actually experience all of these characteristics and more. Anxiety in children is similar to anxiety in adults. They experience excessive fear, worry, or concerns about the future. They also tend to be very afraid for their loved ones and just life in general. Some kids express their fears and concerns verbally, but you might also see refusal or resistance to engage. So they might go into school and they might sit down and say, I'm not doing this. It's not always just them not doing what they don't want to do, but there might be an anxiety situation. And then also they can be disruptive or combative in the classroom because they're trying to take attention away from the thing that is causing them anxiety. Depression, again, continuous feelings of sadness, hopelessness, and loneliness. Again, kids may look more angry or irritable. They might do a lot of crying or yelling, unexplained physical pains. Similar to adults, you might see changes in how they sleep and how they eat. And many of them have thoughts about death or suicide. So we don't want to rule out the impact that depression can have on a child just because they're young, because kids are attempting and completing suicides at an alarming rate. Common treatments for mental illness, and this is for everyone. Psychotherapy, normally adults tend to lean more towards psychotherapy, which is cognitive behavior therapy, family therapy, group therapy. Kids also engage in psychotherapy. Younger children might engage more in creative therapy. That's things like art therapy, play therapy. There are a bunch of therapies that incorporate other mediums, because kids don't, especially younger kids, they don't always have the words to fully express how they feel in a given moment or about a given situation. Kids who struggle with behavior problems, they might undergo a behavior modification program. And that's literally just a system of strategies and supports that are given to teachers and parents and anybody who works with the child to implement on a consistent basis to help modify their behavior. And then I think this is where people start to get a little nervous. We're looking at medication and psychiatric treatment, but again, every case is different. In many cases, that's used as a last resort, but they have their uses. They're used as mood stabilizers, antidepressants, and anti-anxiety medications, and stimulants for people who struggle with attention or struggle with other things that help them to concentrate. The thing about medication is that we have to understand that mental illness it's more than just a behavior or a thought or a feeling. There are actually physiological factors at play. There's things about how your brain connects that influence how you perceive things. There's issues with your hormones and your chemical imbalances. So what medication is supposed to do is it's just supposed to bring your levels to where they're supposed to be so that you can kind of have a level playing field and you can work on the skills that you need to maintain and manage yourself even in the face of a mental illness. So, medication doesn't mean that you have to be dependent on it. It doesn't mean that it has to, you have to be on it for the rest of your life, depending on what your mental illness is, but it is something that can be used as a tool just to get you where you need to be and then move on. All right. This is what untreated mental illness looks like in children. So they may have poor grades and performance in school. You might see a lack of friends or unstable friendships. So if your child is changing friend groups, every 2 weeks at a certain age, that's not really an expected, phenomenon. You might want to just kind of pay attention to that. Trouble getting along with other children and adults, difficulty getting along with family at home. They might be mislabeled or misdiagnosed. As a school psychologist, I often see kids who actually are presenting with mental health concerns, and very often they get put into the special education system, and it's not always appropriate. And it's hard to tell because they're not getting the treatment that they need, and it's impacting, their performance and how they're being perceived at school. They may also engage in self-harm and risk-taking behavior. We've heard of cutting. So that's where some kids will actually make cuts in their own skin as a way to cope with feelings of, depression and hopelessness. And then suicide attempts or completion, which again is becoming increasingly prevalent in children today. In fact, suicide is the second leading cause of children the leading cause of death in children in the United States. Okay, suicide in children of color. It's really important for us to note how important mental health support is for Black children, because we are seeing an increase. Black children have a higher rate of suicide than all other ethnic groups. Thoughts about racism often accompany suicidal thoughts in Black teenagers. From the mid-90s, the suicide rate had increased about 233% compared to 120% of non-Hispanic whites, and that number is increasing. I didn't put it in the presentation, but I believe at this point, Black children are 3 times more likely to attempt a suicide than children of non-color. So these are just some ways to determine whether your child may need some help. So looking at their behavior, you want to just check in and make sure that they're behaving in a way that's appropriate for his or her age. So you want to consult with the pediatrician, you want to consult with the guidance counselor, social worker, psychologist. Is this appropriate? And again, if it's a concern. So if your child maybe has a lot of tantrums, and they're 8 or 9 years old and they're still tantruming the same way that they were when they were 5, right? You want to check in on that. Is that normal for their age? Is this a concern? What is the overall impact on how they're functioning? So again, is it affecting their grades? Is it affecting their ability to make friends? Is it affecting their ability to, again, just do basic self-care things? You have to constantly go behind your 13-year-old to brush their teeth. By 13, that should be that should be a pretty consistent expectation, right? So again, just checking in on that. How big of an issue is that? Have your child's friend groups, eating and sleeping habits, or any other significant factors changed drastically? So again, if your child was pretty happy-go-lucky up until the age of 6, and then all of a sudden they're super resistant and defiant, and it seems to have come out of nowhere, is something you want to look into. If they were always maybe a little grumpy or cranky and maybe needed a little more of a push here and there, you know, maybe not so much of a concern, but you still want to check in on it and make sure that it's not, you know, preventing them from living a full life. Is this a phase or is it a problem? So again, it's really hard with kids because they go through so much, right? They go through growth spurts, they go through puberty, there's all kinds of things. They go from grade to grade, they go from, you know, from one school to another school. So there's all these things that would make sense for your child to act differently here and there, but pay attention to how long this thing is happening, right? So again, if they're normally a happy and respectful kid and, you know, they get a little, you know, defiant here and there, but it lasts for like a week or two, okay, maybe that was just a little change that they needed to go through. But if it's like an ongoing thing, it's been a month, 3 months, 6 months, then, you know, you want to look into that. Is this a phase or is it a problem? Are behavior changes in direct response to an event? So again, if they're grieving, if they lose someone, especially someone that they were close to, if there are changes in your home or living situation, moving, or someone moved in or someone moved out, all of that has an impact on a child, and they may change their behavior as part of their transition to the change or adjustment to the change. But again, if it's an ongoing, constant thing and it goes against what you know about your child, at some point you want to say, let's look into this. And again, how easily rectified are challenging behaviors. So if you have a system set up, you have a system of discipline, of you know, supportiveness, and you know, you have it set up so that your child has a stable environment and understands cause and effect and consequences, and those are still not enough to help them to stabilize, then you want to seek some additional support. So these are just some steps you can take if you think your child needs help. The first thing is to talk to them. A lot of kids, they just don't have the words. It's not that they don't want to talk to you, but you kind of have to be the person to reach out sometimes. If they're younger, you can read a book with them related to the concerns that you have. There are tons of children's books that talk about anger and sadness and worry. So you read the book and you ask, what do you think about it? A lot of them will be able to tell you how they relate to the emotions that they see in the story, using an emotions chart to help them pinpoint their feelings. Again, sometimes they don't know the words, but they can recognize the facial expression, right? If they're older, you can really just be direct. Tell them what you've observed and ask direct questions. One thing I find that parents are afraid to approach their children about are things like suicide and self-harm, but ask them directly. And many of them, or most of them, I found will answer you honestly. If you say, are you thinking about hurting yourself? Are you thinking about suicide? They'll say yes or no. And you want to give them that opportunity because most of them want help. So that they don't do those things. Most of them don't want to be harmed or die, but they don't know what else to do. And so when you open up that line of communication, it gives them, it gives them kind of a lifeline to hold on to. The next thing you want to do is you want to consult again with other adults and even peers. If you have relationships with your child's friends or your child's friends' families, ask them, have you noticed something different? And not in a way that's, gossipy, but as the parent, it's your responsibility, right? So, hey, I'm noticing that he's being a little bit different. Do you see it? Because sometimes people see things in your child that may not be presented to you right away. So if you think something's off, ask someone. Again, talk to their doctor, talk to the school clinicians, and identify areas of concern and possible interventions for support. And then finally, seek professional help. If you've tried everything else and you find that it's just not effective, seek professional help. Request a referral. You can always request referrals from your pediatrician. Your school is also a really good place of resources, especially for local entities, local professionals, and identify evidence-based mental health strategies to help support your child on a daily basis. I'm going to share some resources a little bit later on, but it's always good to connect with the people who already know your child because they have a better chance of leading you in the direction that you need to go. And then my last point, please do not attempt to self-diagnose a mental disorder in your child. Again, mental illnesses are just as real as physical illnesses. So just like you wouldn't try to diagnose cancer by yourself, you wouldn't try to diagnose diabetes or anything else by yourself, please don't try to self-diagnose a mental disorder. Stick to what you are observing and speak to a professional who's trained in the field, because what you don't want to do is accidentally mistreat your child because you think it's one thing and it turns out to be something else. Okay. And then we just want to practice daily mental hygiene with our children. So promoting confidence and self-esteem, lots of praise and encouragement. Try to avoid unnecessary negative remarks. I think as a culture, we have a habit of just saying things, or we say things to other adults and we say it to kids, and they don't always respond the same way. They internalize a lot and they may not tell you, you might not know until they're adults themselves, you know, but try to just avoid anything that you don't want them to internalize. Try not to say it. Allow room for mistakes and imperfections. So acknowledge when they make a mistake, but again, you don't want them to internalize feelings of defeat. You want them to look at that as opportunities and lessons to do better next time. Fair and measured discipline. I always say, try not to discipline with emotion, but with purpose. So what's the lesson that they need to learn? What is the behavior that this discipline is connected to? Not so much focused on how you might be disappointed or how you might be upset about what they did, but what are you training them and disciplining them to do and to be as they grow older? You know, teach and model healthy social behaviors and relationships. So again, our kids watch us, they listen to us, and they internalize a lot. So if you have a revolving door of relationships and friendships, then they think that's normal, and it's not necessarily a stable situation, right? And then when you need support, you don't necessarily have what you need. So you want to be the model and the example, because sometimes they're listening and sometimes they're watching, and you never know which is which, right? So you want to try to hit as many points as possible. And again, just encourage a positive mindset. Practice gratefulness, you know, have them think about what they're thankful for. What are the things that you have, you know, that other people may not have, or that if you didn't have, you'd really be upset or you'd really have a problem, you know. Turn difficulties and setbacks into goals and solutions. And again, just encourage and praise anytime that they're trying and doing their best, even if they're not exactly where they need to be. You still want to just continue to encourage them because they can get there. And finally, these are just some resources for education and support. If you are looking for a therapist in particular, I find that Therapy for Black Girls and Therapy for Black Men they're very good directories. I actually found my own therapist through Therapy for Black Girls. The Child Mind Institute and the National Institute of Mental Health have some really good resources if you want to learn more about mental illness or specific mental health disorders or mental disorders. Psychology Today is also another good directory. If you have a specific preference, like if you are looking for someone who's a Christian or a Muslim or whatever, there's a way to search for that specifically. A lot of these directories, you can also search by insurance and location. So, you know, there are options for you. The Depression and Bipolar Alliance also is another good resource for education, and you can learn a lot about other mental illnesses. They also talk about anxiety. They also talk about a lot of other mental health concerns. And then these are just some books that I thought were good reads if you want to learn about just daily mental hygiene and how stress impacts people from generation to generation. So The Unapologetic Guide to Black Mental Health and The Body Keeps the Score. Okay, so that is my presentation. Are there any questions? I see there's some things happening in the chat. Oh, okay. So I'm going to stop sharing. So does anybody have anything they'd like to ask or concerns or?
I'll go first. First of all, thank you for that presentation. It was absolutely spot on, and it's just very informational and very educational. Um, this is more of a personal question. So, growing up, I've always been involved in soccer. I played at the highest level. I played professionally, and just growing up as an athlete, you're always told to take care of your body, whether it's eating well, getting rest, drinking, hydrating your body, so on and so forth. But I think that the mental health part of it has always been more pushed to the side to a certain extent. Um, what advice would you give to a young player who wants to play at the highest level in terms of his or her mental health, to deal with it?
I think first of all, like you said, just paying attention to your whole self. So just like you had to learn what your body responds to, you need to learn what your mind and what your emotions respond to. So if you find that certain things are more stressful to you, do your best to circumvent that, right? So I don't know how rigorous your schedule was in terms of practice, but if getting up at 4 a.m. is more stressful to you to go to practice, but you know you need to go, then how do you circumvent that? Maybe after practice, you make sure you set aside time to rest, right? And to rest and recover. I think also just preparing yourself. I think that helps a lot. I do psychotherapy for children and adults, and a lot of them, what they struggle with when they struggle with anxiety, a lot of it has to do with just not preparing and bracing themselves for things that they know will be stressful to them. So if you know that, this is going to be a long day, and after a long day, I know I'm spent, I don't have anything else. Maybe before that day, you set aside that time to do the things you need to do to charge yourself. And then maybe after that day, you set aside a little bit more time to continue to recharge yourself. But you want to prepare. I think that's the biggest thing. Prepare yourself for the stressors if you can't avoid them. If you can avoid them, avoid them. And if not, then always kind of have a recovery plan. So just like, you do a rigorous exercise or rigorous workout, and you can correct me, but my understanding is you're supposed to give your body rest at times as well, right? So the same thing for your mind. You're going to have rigorous days and times and schedules. You also have to pencil in those times for rest. You can't be on all the time.
Thank you.
I did have a comment, not a question, but a comment. First, Jalisa, I think this was an amazing presentation. I had a lot of really important information and everything was really well said. I was thinking as you were presenting specifically about families, especially, Black families, especially living in certain communities and families and children that are exposed to trauma, and the way that they respond when talking about mental illness and medication, especially with that treatment. That is something that I see in my work as well as a school psychologist working in Hartford. And of course, as a school, we can't broach the subject of medicine, but sometimes families may disclose to us that is something that they've spoken about, like with pediatricians for their child's, mental health needs or medical needs. And so I think just that point that you made about leveling the playing field, with treating mental illness is so important. And that kind of gives me another way, if questions should come on, just another way to present it to families who really feel hesitant, and rightfully so, about utilizing medication, with just knowing, that it's another option. It's really just providing your child with that kind of opportunity and like that baseline in order to access the tools and access, whatever is going on in their environment to succeed. I think that was really, well worded and definitely helpful, for, as I continue to work with parents on that subject. So thank you.
Thank you. Yeah, we're getting there. So yeah, if nobody else has anything, I'm gonna turn it back over to.
I have a question.
Yes, sir.
So I guess, I feel like growing up in a Caribbean community, I feel like, counseling and, anything that has to do with just a counselor to have some mental help or something of that nature, I feel like it's shunned, that people don't want to be associated with that. Mm-hmm. So it's just like, how do you now make something of this nature, which is actually healthy, you know, that was deemed almost like, I don't know, like they're ashamed of, you know, speak about having a counselor. Like, how do you as a counselor, like, what would be something if we even, not so much diagnose, but I mean, there's certain behaviors with children that is what I would say would be obvious. How do we then, you know, whether it's bring it to a parent or just, you know, just to even have a conversation about, or even just, you know, make that an option? How would you, you know, suggest a way of, you know, saying that or introducing to them? Like, how would you reference that to them?
Okay. So first, can I ask, what capacity are you asking in? So are you as like a teacher or a coach or?
Well, in my capacity, it would be a coach, right?
Okay.
So yeah.
Yeah. So I'm asking, I asked that because it's depending on your relationship with the parent. So first off, I usually just say they may need to talk to somebody. I try not to tell parents what to do with their kids unless they ask me directly, if that makes sense. So I might say, well, you know, I'm noticing that little Timothy's having a hard time getting along with the other kids. You know, is there anybody he can talk to? You know, so just kind of having that conversation open. Is there anybody that, you know, really works well with him or that he really responds to? And if you know that you have parents who kind of hold you in high esteem, use that to kind of say, you know, there's nothing wrong with maybe seeking some professional support. I also often encourage parents to talk to their pediatrician, because I notice that parents tend to talk to their kids' doctors and they receive them a little bit better than a lot of school staff. So I might say, you know, did you talk with their doctor about this? You know, maybe they can refer you to someone. So I put it out there and make sure that they know that it's their choice. But if you feel very strongly about it, it can also be a strong suggestion. You know, I really think it would benefit your child if they did this, but also kind of making sure that they understand it's their choice, because like you said, this is a very sensitive topic for our communities in general. We have a lot of negative history with institutions, period, and counseling and mental health is included in that. So we want to be sensitive to that, but exactly like you said, there's also reducing the stigma. The other thing you might want to do is just, like, this in and of itself reduces the stigma because we're talking about it, we're dispelling myths. So you can even present it that way. They're talking to a professional who's been trained. You know, they're not going somewhere to just tell their business, you know, but this is someone who's trained, who's not going to share their information, and they're literally just going to share information with you. It's up to you whether you're going to use it or not. I hope that was helpful.
Thank you so much. That was helpful.
I have one more question. During the presentation, you mentioned, I'm not quite sure the exact number, but you mentioned that Black children are, I don't remember the exact number, but they're more likely to, I think it's a suicide attempt or something along those lines.
Mm-hmm.
And I don't remember the exact number again. But what are your thoughts on that? What do you think is driving that?
Well, I think, you know, like most other entities, there's a lack of access and information in our communities compared to other ethnic groups. I also think for a lot of us in our community, we identify with this idea of strength and being strong enough and just kind of pushing through. I actually had a talk a couple of weeks ago about there's almost this sense of if you had to get help to accomplish it, it's almost not even a real accomplishment. So I think there's still a very strong stigma in our communities about what getting help, period, is. There's still people that don't even like to go to the doctor, the medical doctor, just to get their bodies checked out. So again, a lot of it has to do with this being seen as a more taboo topic for a longer time in our community than we've observed in other communities. So it has to be talked about more. And then there has to be more information. You saw me put in that slide, please do not attempt to diagnose your own child or self-diagnose, because we see that a lot too. People read one little line and they go, oh, I know what that is. and again, they try to do it all themselves. So I think there are cultural components, there's a historical component, and then access. So unfortunately, mental health or quality mental health support and resources are not fully accessible to us like they might be in other communities, right? So there's an economic deficit, there's a disparity in terms of location. And again, people don't even know what supports are available to them for free or would be covered by their insurance. So I think the more that we talk about it, the more we educate people, the more you hold conversations like this, we'll start to see more of a decline. But I think a lot of it has to do with our kids they're not given that opportunity to get the help and the support that they need. And as a result, they're trying to cope on their own and they can't. So once things are identified, we really want to move on it, as soon as you see it. I once had a child who I think he was 8 years old. And he gave me a very descriptive story about how he would kill himself. And I called his mom and I said, this is, the information he relayed to me. And that was a situation where I said, you need to take him. In fact, I don't even think I strongly suggested, I said, you need to take him to see and this was in the school capacity, not as a psychotherapist, but as a school psychologist, I said, you need to take him to his doctor. You need to have a conversation with his pediatrician and he needs to talk to someone. And she really didn't hear me right away. And it took some time for her to initiate that process. So I think we have to also understand and acknowledge the severity of this issue of generations of trauma, racial trauma, historical trauma as a community and how it impacts us collectively and individually. And we see, the after effects in our children.
Thank you. Excellent.
So yeah, I'm gonna turn it back over to you.
Sorry, I had a couple of comments. I thought someone else had raised their hand. Presentation was great. Thank you for that. And I agree with the comments made earlier regarding West Indian people in particular. The entire topic of having any kind of mental illness is just kind of a taboo thing within our communities, where you have the parents themselves, if there may be an issue where they would need to see someone or seek some kind of a help, there's, like a hesitancy to even do that for themselves. And then you take account into things that may be going on with children that are not being noticed or, taken seriously. So it's always been an interesting thing for me, even with personal family things. Once I really started paying attention to mental health in recent years, things that you notice and you look back on, you're like, wow, you don't know until you know,
Right.
really. And when you started out the presentation with the statistics and looking at, I think it said it was like 32% of adults have a diagnosed mental condition. And that stood out to me because you're thinking about people who actually speak up and, they're able to get a diagnosis, and you think how many actually are not included because people are hiding, what's going on. So that's my problem. But yeah, the presentation was great. I really appreciated this. Thanks.
Thank you. And I appreciate that comment because again, Black families or Black people are less likely to be diagnosed, which means that they're less likely to receive treatment.
Right.
And I started with adults because that phrase, in the airplane, you got to put your mask on first before you help someone else. So it's going to be hard to support your children with their mental health concerns.
If you don't get the help, right?
Yeah, because you won't be able to see it yourself because you're struggling with your own. So thank you for that comment. I really appreciate that.
I think especially in the West Indian community, growing up in a traditional Jamaican family, like as an adult now, having the knowledge, having the training, us being in the roles that we're in as school psychologists, And then also speaking about my personal experiences, like I try to, dispel whatever myths within my family and in my friendships, and in whatever personal interactions I can to continue to fight against that stigma. So knowing, and again, you don't even have to be like a professional rooted in mental health, but when we arm ourselves with that knowledge, I think it's our responsibility to continue to spread that knowledge. So in my conversations with my family, who, different members struggle with different, mental health struggles, but then I also have people in my family who don't feel like, it's like, you got to pray it out, or you got to go to church, or nothing wrong. Like, really engaging in that conversation with them to say like, hey, this is what's actually going on, or here, what you're saying actually isn't accurate. Here's what, just spreading the knowledge that I have. And then of course, engaging in those conversations when I can in my job as well as a school psychologist, because I work with in a neighborhood and in a neighborhood school where there are a lot of West Indian families. These sorts of conversations come up often when we're talking about the child's overall well-being in the school setting. And so, for my piece for advocacy, and I'm sure many of us do it too, or at least have considered doing it, just even opening up that conversation, I think can be useful.
Yeah, absolutely. Yeah, it's really the conversation. It's really just walking into a room and be like, I was talking to my therapist the other day, and this is what she said. It's literally just normalizing it.
My therapist got me right together.
Exactly. Like it's just not a big deal. And it's really not. It's like going to the dentist or going to, less traumatic than going to the dentist, because you're just going and you're talking and they're giving you strategies. It's like going to your regular checkup with your PCP, right? You just walk in, what's going on? This is what's going on. Okay, what do you need? These are some strategies. This is what'll help you out. It's a professional relationship. It's a professional alliance. They're not there to be, your next auntie or your next, friend or this, that. It's a professional relationship. We have guidelines. We have ethics that we have to attend to. We're compelled to protect your confidentiality. We have to protect, your personal safety. Like, we have to be cognizant of who you are and what we're there for. So, it's you going to the bank. any other profession you can think of, we're in line with that. So yeah.
Do we have any additional questions, comments? Yes, no, maybe so, no. All right, Leanne, are you available?
I am.
Do you want to close this out, or do you want me to do it?
I'll do it. I just want to thank everyone for coming and participating. I think it's a really important conversation that we need to have more of, especially in our community. And I want to give a tremendous amount of thanks to you, Dr. Barnes, for your knowledge and for being willing to have the conversation with us. And I think it's wonderful. I think we need to do more of this. And I think the more we do it, the more it does become something that's normal and accepted. And, we can just talk more and feel more comfortable. So I'm grateful to you for that. And thank you, Keneal, for your efforts and for this program. I think this is a necessary program for the community, for our children, and also to really be able to bridge the gap between the community and the resources that we have, and the and really just start to create more of a community. So I'm thankful to you for that as well. Thank you. Thank you all.
Thank you.
All right, so Shanae, I think you just asked a question in the group, right? Was that you?
Yes, sorry, I didn't want to interrupt. Yes, I was wondering if this presentation would be available on the website. I would just share it in my email listservs at my 2 schools where I am for work. But Jalisa did just say that she would also share it as well.
I'll share it with Mr. Martin and Ms. Thompson, and I'll leave it up to you guys to post.
All right. Sounds good.
All right.
Thank you.
All right, guys, have a good day. Thank you again.
Have a beautiful one.
Thank you.
Yeah.
Thanks, Camille. Good job, Jalisa.
Bye, girl.
Bye.